So, Dr. Kian, we always have to go back to our triangle of gut, skin, brain axis.
Absolutely.
And we can start with the brain. Sometimes we can start with the gut, but we'll always see the effects on the skin. And as we are working in an aesthetic clinic, we see many patients with acne, many patients with rosacea. Rosacea, remember, is that rosy cheek and red appearance of fine blood vessels on the skin. And rosacea is an inflammatory condition. Acne, we can also classify as an inflammatory condition. So how can we address the root cause of these skin problems? We have to go back to the gut.
Absolutely.
And again, the brain. Brain, gut, skin, brain, gut, skin. But let's speak about how stress and our lifestyle leads to gut problems, which leads to acne and specifically rosacea.
Yeah, absolutely. The person, like, if we see a eczema patient, a relapse is most of the time caused by a stress or trauma response.
Absolutely.
Why does that happen? Because the brain experienced the trauma. It gave the message to make stress hormones. It activates the inflammation in the gut, tears the gut lining, bacteria leaks out, and your skin is the communication organ. We can think we can fake it till we make it, but we can't. Our skin will communicate what is happening. The same is happening when there's somebody that you know very well. They went through a very dramatic thing in their life, say a death of a family member, and afterwards when you see them, you would think, sure, but this thing has aged them. So for some patients, it will not manifest in the form of rosacea or eczema or acne, but the inflammation is sitting in the skin and breaks down collagen.
Absolutely.
So we can go for our microneedling treatments. We can go for our biostimulators and all these things, which is absolutely brilliant.
Yes.
But if we are bringing our gut into our daily mindfulness of having a good and healthy gut and the effect of that on our skin, we can really prolong our benefits from what our other aesthetic treatments.
And that's how we are working from the inside out and the outside in.
Yes.
I have a patient who had eczema in Johannesburg. It was quite severe, got it under control, moved to George, had quite a few traumatic experiences with adjusting and other traumatic things that happened. And the eczema was just right back. And now we're working with the guts.
Absolutely.
And as she has to go through the 6-hour rehabilitation program of the gut, she is excluding a few food sensitivities, and that's already helping. What does that tell us? That it starts in the gut. But it was the traumatic event that switched it on again. The stress hormones, the cortisol, working to the gut, giving the eczema on the skin. So we have to always think gut when you do eczema treatments, rosacea, any skin problems, but just as you said, aging. And that's exactly when you see someone 2 years ago, you think they've aged 10 years due to trauma.